Kelly, and thank you to University Conference Services for hosting. Welcome, everyone. I'm Lori Lucas, the President and CEO of EBRI. And thank you for joining our e-briefing on consumer engagement in healthcare among millennials, baby boomers, and Gen X with a focus on millennials. And I apologize in advance that we are referring to the generation that follows Generation X as millennials, because I understand they don't particularly love that connotation. But take it from a baby boomer, it is better than what we used to be called. If you, for those of you who go back a ways, we started off as the me generation, apparently referring to our self-involved qualities, according to Thomas Wolfe. So I think millennials is a little better than that. I'm delighted to say I'm joined today by Victoria Pavlov, who is the Director of Health and Wellbeing at American Express. Victoria is responsible for the strategy and design of health, welfare, and well-being programs and oversees the life, disability, medical, dental, and vision plans at American Express, as well as the well-being programs offered in the U.S. by American Express. I am also joined by Paul Fronstin, the Director of the Health Research and Education Program at EBRI. Paul also oversees our Consumer Engagement Survey, which is what we will be hearing from him today. Our agenda for the day is turn to the agenda page. Our agenda for today is starting with hearing from Victoria about American Express's experience with millennials and healthcare engagement. We also will hear from evidence from the Consumer Engagement and Healthcare Survey that EBRI conducts from Paul Fronstin. And we'll wrap up with millennials and HSAs, what we're seeing in the EBRI HSA database, our proprietary database of empirical HSA data. On the next slide, we talk about why we are focusing on millennials. And millennials now outnumber baby boomers as of 2015, with 83 million millennials versus 75 million baby boomers. So there's a strong interest on this generation, and particularly how they differ from other generations. However, much of the research that examines millennials is doing so in the context of retail markets because of their spending power. However, you can imagine that employers would also be very interested in this generation and how they fit into the labor force and how they use things like benefits, and specifically healthcare benefits. So our recent EBRI research, which Paul will talk about, will focus on the difference in consumer engagement in healthcare by generational cohorts, looking specifically at how healthcare is used differently and how millennials interact differently with their healthcare providers.
I'm going to first talk about our findings from the annual EBRI Greenwald and Associates Consumer Engagement and Healthcare Survey. This is a survey that we've been doing every year since 2005, where we interview adults between the ages of 21 and 64 that have private health insurance coverage. The survey has mainly been used to explore differences in attitudes and opinions between people with consumer-driven health plans, high-deductible health plans, and plans that aren't consumer-driven or high-deductible health plans. But we've recently decided to use the survey to look at generational cohort differences. I'm going to be presenting findings from our 2017 survey, which was conducted last August. The 2018 survey is in progress. It'll go into the field next month. And if anybody's, we do seek funding for the survey. If anybody's interested in helping us out and being involved in the survey, please contact me or Lori afterwards. This is a survey. It takes about 15 minutes to complete. It's done online. We use an online panel, and we have about, when you add up all the sample sizes, close to 4,000 people have responded to the survey. So it's a very rich data set with a relatively large sample for an online survey or public opinion survey, and we find some very interesting differences in attitudes and opinions between generational cohorts. So I'm going to walk you through some of those findings right now. So for example, we asked a series of questions related to people's relationship with their primary care provider, among people with a primary care provider. And there's a number of places where we don't find any differences by generational cohort. So we don't find any difference regarding this first question at the top here. After seeing my primary doctor, I make healthier lifestyle choices. You have between 75 and 80% of the population that answer that they strongly or somewhat agree with that statement. Similarly, we don't find any difference when it comes to this next one. It's important to me that my doctor knows me and my medical history personally. 90% plus responded that they strongly or somewhat agreed with that statement. And you can see the other ones where we don't find any differences. And where we don't find differences, the answers tend to be large. 90% or more respond that they strongly or somewhat agree with the statement. Where we do find differences is in these two questions in the middle. One, my primary doctor does not have the expertise to deal with complex health issues. There we find millennials are more likely than Generation X and baby boomers to strongly or somewhat agree with that statement. Millennials are more likely to say that they don't think their primary care doctor has the expertise to deal with complex health issues. And also, we find that millennials are more likely than Generation X and baby boomers to say that they rely on themselves. I rely on myself more than my primary doctor to make decisions about my medical care. So it's interesting that, and this is among people with a primary care physician, that despite the fact that they have one and presumably have some type of relationship with that physician, millennials are more likely to rely on themselves and question the expertise of their primary care physician. On the next slide, it shouldn't be a surprise then that millennials have less attachment to the healthcare system and are more open to alternative arrangements. So when you just ask them if they have a primary care doctor, millennials are less likely than baby boomers and Generation X to tell us that they have a primary care doctor. And we don't know, maybe some of them did in the past, and because of their attitudes regarding their trust in the expertise of that doctor and who makes those decisions, healthcare decisions, maybe they don't have one anymore. Maybe they don't have a primary care doctor because they're younger and haven't gotten to the point where they have health conditions that would require them to go see a primary care doctor. But there's no doubt they have less attachment to primary care doctors. They're more likely to use a walk-in clinic. 30% of millennials told us that they've used a walk-in clinic compared to only 14% among baby boomers. So they are getting healthcare services, and they're interested in a telemedicine option. 40% tell us that they're extremely or very, that a telemedicine option is extremely or very important, compared to only 19% among baby boomers and 27% among Generation X. So clearly, and obviously we could have asked many more questions regarding attachments to the healthcare system, but I think these are very interesting, very interesting takeaway here that it's different for this population, and I think this is one of the reasons why employers are so interested in this population, because they are larger than the baby boom population. I think there's still this outstanding question as to whether or not the millennial population will change as they get older and start experiencing some of the health issues that Generation X and baby boomers are now experiencing, and whether or not they'll start to look like baby boomers and Generation X at some point. That's still something we don't know the answer to. When it comes to cost-conscious decision-making, we've asked a series of questions for quite a while. You can see the slide's very busy, lots of questions on cost-conscious decision-making, and I'll point out a few of them. I'm not going to go through each of these individually, but you can see there's this pattern where millennials are more likely to respond that they're making these cost-conscious decisions than Generation X and baby boomers. So at the top, millennials are more likely to report that they have found cost information, one that they've searched for cost information, actually found what they were looking for, more likely to have checked whether the health plan would cover care or medication before getting services, more likely to check the quality ratings before receiving care, more likely to talk to their doctor about prescription options and costs as well as treatment options and costs, more likely to develop a budget, more likely to use an online tracking tool. So you can see almost across the board in every question we ask, millennials are more likely than Generation X and baby boomers to be making that cost-conscious decision. Interestingly, they're as equally likely to ask for a generic as a brand name, instead of a brand name compared, the three generational cohorts. There's no difference there. About 40% say they've asked for a generic instead of a brand name. But if you look at the bottom of the slide, we actually find millennials are more likely than the other age cohorts to tell us that they've asked for a brand name instead of a generic. And if anybody has any thoughts about that, please chime in. That may be some association with brand names. It may be that they don't have a lot of healthcare expenses, so they don't mind spending a little bit more on brand names. We didn't dig into this any more than just this one question, so I'd certainly be open. I'm just coming up with some ideas here. I'm certainly open to other reasons why we may be seeing such a finding. And the other thing we found is wellness program participation varies by generational cohort, with millennials being more likely, in some cases much more likely, to participate in a wellness program. You can see that they're more likely to have used an on-site clinic, more likely to have taken a tobacco-free pledge or participated in a smoking cessation program, more likely to have used counseling or stress management, mindfulness classes. They're more likely to participate in activity-based wellness challenges, have sought out reimbursement for part or all of their fitness club membership, which they may be even more interested in if the HSA law that passed the House yesterday makes it through the Senate as well. They're more likely to attend free seminars or guest lectures about health and wellness, and more likely to take advantage of financial wellness resources. I do find it interesting that when it comes to health risk assessments and biometric screenings, perhaps the programs that employers have been pushing and have introduced financial incentives to participate in, you're not seeing any difference in participation by generational cohort. We asked a series of questions to try and get at some trade-offs that people are willing to make regarding their health plan design. So we asked them, are you interested in a health plan with lower premiums and lower out-of-pocket costs that would limit your choice of doctors and require prior approvals? So are you willing to trade off having lower costs for more restrictions on access to care? Or are you interested in a plan with higher premiums and higher out-of-pocket costs that has virtually no restrictions on your choice of doctor and no prior approvals? And third, we asked, are you interested in this health plan with higher upfront out-of-pocket costs, but lower premiums that gives you incentives to shop for the most efficient services using cost and quality information? We wanted to see if there were large differences in terms of the kinds of health plans or the kinds of trade-offs that people were willing to make in their health plan by generational cohort. And for the most part, we didn't find a strong story here. Interestingly, if you look at that last option, the health plan with higher upfront out-of-pocket costs, with lower premiums and incentives to shop using cost and quality information, despite the fact that millennials may be open to alternative healthcare delivery systems, they're actually less interested in this than baby boomers, 10% versus 19%. But where you do find another big difference is in the no preference answer. I found that to be, I think, the most interesting here, where 31% of millennials tell us they have no preference versus 26% for Generation X and 22% for baby boomers. To me, this suggests that there's an opportunity here to see what millennials may really think and maybe drive the types of health benefits that are being offered to them, maybe even without their input, because they don't have a strong opinion, or at least they're more likely to not have a strong opinion compared to other generational cohorts. We asked a series of questions about satisfaction with various aspects of health coverage, and for the most part, we don't find, there are some statistically significant differences by generational cohort, but they're very small, and so there's really very little difference in terms of overall satisfaction with the plan, choice of doctors, quality of health care people get, and the ease of getting a doctor appointment. Where we do find a relatively big difference is when it comes to out-of-pocket costs. So you can see we asked it both for out-of-pocket costs for prescription drugs as well as out-of-pocket costs for other healthcare services. And we find that millennials are more satisfied with their out-of-pocket costs than baby boomers and Generation X. I don't think anybody should be surprised by this finding. Millennials use less health care, so they're spending less out-of-pocket. They're more likely to only know a health plan with high out-of-pocket expenses. You know, if we think about what a traditional health plan looks like, you know, a lot of us think of a traditional health plan as having a low or no deductible and small co-payments. Well, for traditional for millennial, maybe a high deductible health plan. So they've never gone through, you know, this stage where they've gone from a plan with very comprehensive coverage to a plan with less comprehensive coverage. This may be all that they know. So that may be another reason why they are more satisfied with their out-of-pocket spending. And when it comes to satisfaction with various aspects of health plan choices, millennials are more satisfied with the ease of selecting a plan. They're more satisfied with the information given to them to help them make a choice regarding their health plan. They're more satisfied with the number of health plans to choose from, and more satisfied with the availability of affordable health plans. So when it comes to the non-financial aspects of health insurance, there's no difference in satisfaction. When it comes to the financial aspects of health insurance, millennials are more satisfied than other generational cohorts. And when it comes to how people select their plan, the information given to them, and the kinds of plans offered to them, they're more satisfied as well. And finally, from the survey, we asked a series of questions about health savings accounts. And we find some interesting differences by age cohort. We find that millennials and Generation X are more likely than baby boomers to be strongly or somewhat agree that they need help determining how much money they should be putting in their HSA versus other investments or expenses. Millennials are also more likely to report that they're interested in automatic investment features for their HSA funds. And they're also more likely to tell us that they're interested in investing some of their HSA money in stocks, bonds, or mutual funds. So they're more likely to be interested in investments and more likely to tell us they need some help determining how much money they should be putting into their accounts. You can see there are other questions here where we found no difference by age cohort. So we decided, you know what, we've got another database, the EBRI HSA database, where we could actually probe some differences in behavior by generational cohort. So I'm going to turn to some findings from the EBRI HSA database. This is a database where we get information on HSAs. It's a very large database. So unlike the 4,000 or so people we interviewed to get their attitudes and opinions, as of 2016, we have 5.5 million accounts in our database with over $11 billion in assets. And this is the kind of information we're collecting in this database. So for every one of these 5.5 million accounts, we know how much money they started the year with in their account. We know their beginning year balance. We know how much money they ended the year with in their account. We know how much money they put into the account, and we know how much money their employer put into the account. We know how much money is coming out. We don't know whether those distributions are for qualified medical expenses. but we know, and we don't know at what point during the year they took a distribution, but we know how much the annual distribution was. We know when the account was opened or closed, for those accounts that were closed. We have some very basic demographic information on account owners' age. We know whether or not they invest in anything other than cash and how much of their balance is invested, and we have some information about transfers in and out of the account. We don't have the kind of demographic information we would love to have. So we don't know the account owner's income, we don't know their education, we don't know their race, but because we get zip code information, we're able to geocode that and determine the, say, median household income in the person's county, or the median education level in the person's county, and the race, the distribution of people in the county by race. So we have some information there. And here's what we know in terms of generational cohort differences. Keep in mind, these slides from here on out have never been published. So you're getting a first-hand preview into new findings from EBRI. One of the things we found was when it comes to how long people have had their account, millennials have had their account for less time than Generation X and baby boomers. So if you just focus on the 2015 and 2016 findings and combine them, 55% of millennials have opened their HSA in just those 2 years, whereas only 38% of baby boomers had opened their HSA in those 2 years, which means that baby boomers have had their accounts for a longer period of time. Generation X has had their accounts for a longer period of time. They've had more experience with the accounts. They're probably more educated about them, know more about how they work, which could explain some of the differences that we see by generational cohort. When it comes to contributions into HSAs by generational cohort, baby boomers and Generation X put more money into their account than millennials. You can see that baby boomers are putting in over $2,500. Generation X is putting in almost $2,200, whereas millennials are only putting in $1,300. This could be due to a number of different reasons. It could be because older people tend to make more money than younger people, therefore they have more means to contribute to the account. It could be because millennials have had their accounts for less period of time, and therefore they don't know all the benefits of contributing to the account. Maybe they don't know, maybe they're not completely sure of the tax treatment. Maybe because they use less healthcare services, they are funding the account at a lower level because they don't feel the need to fund the account because they're not using healthcare. Number of reasons why they would fund the account less. When it comes to employer contributions, we see differences there, though they're not as large. Baby boomers and Generation X are receiving just over $1,000 in employer contributions, whereas millennials are receiving just over $800. And this may be simply because millennials are in jobs that contribute less on average, because employers really can't discriminate their contributions based on age. On the next slide, here's where we looked at whether or not people are investing. And you can see all the way to the right on this slide, it doesn't matter which age cohort we look at, the percentage that are investing is low. And while there's a small difference between millennials and the other age cohorts, it's small and it's low. 4%, about 4% are investing. So it's interesting to me that when you ask millennials these questions from our consumer engagement healthcare survey, when you ask them questions about HSAs, they're much more interested in investments, yet they're not more likely to invest. And just so you can see here, I threw out some other findings as well. Millennials are a little bit less likely to be contributing to their account. They're actually a little bit more likely than baby boomers to have an employer contribution. It's just that the employer contribution is lower. And not surprisingly, they're less likely than than baby boomers and Generation X to take a distribution. No surprise there because they're less likely to use healthcare services. But I think it's that investments finding that's interesting given the interest that millennials tell us they have in investing from our other survey. We decided to look at this a little bit differently. Maybe what we're missing is what we need to do is look at how investment behavior and some of these other variables vary by the length of time people have had their accounts. Right? One of the things that may bias the results on the prior slide is that millennials have had the accounts for a shorter period of time. So here we're looking at how individual contributions vary by the length of time people have had their account or the year that the account was opened by generational cohort. And if millennials that have had the accounts for a longer period of time have finally figured out how these accounts work, you would see a much smaller difference in individual contributions for accounts that were opened, say, 10 years ago, in 2006 or in 2008. You'd see a smaller gap between the age cohorts, and we're not actually finding that. You'd expect the older years or the earlier years to see smaller gaps, and with millennials catching up at some point, and we're not finding that for individual contributions. We are finding that when it comes to the percentage of account owners with investments, there's no difference there, regardless of when you look at it. So it's not like it looks better in the historical data than the more recent data, but I think this is because there's so few people investing overall. But clearly, one of the things you should take away from the slide is the longer somebody has had an account, the more likely they are to invest. So among people regardless of generational cohort, among people who have opened their account in 2016, less than 2% are investing, about 1.5%. But if you go all the way back to 2006, among accounts opened in 2006, between 8 and 10% are investing in 2016. Okay, and so you can see clearly the longer someone's had an account, the more likely they are to invest, which means at some point either they built up a large enough account balance to start investing, because most HSA providers require that you have a minimum balance before you invest, or at some point they realize that the investment option is there and they start to take advantage of it, or at some point they realize they've got enough money above the deductible that they could cover a catastrophic event, and therefore they invest the portion that's above the deductible. Something's causing them to invest at some point. They figure out that that's an option. It's still relatively low, right? Still 10 years after someone's opened an account, only 8 to 10% are investing. No differences by generational cohort, but this is what you'd expect to see. And finally, one of the other things we wanted to look at was, do you see the percentage of account owners who contribute the maximum changing over time? We're interested in this because the legislation that passed yesterday in the House of Representatives would allow people to increase their contributions. And here we saw, other than the millennial generation being less likely to contribute the maximum, the pattern's the same. You see a little bit, once you get past 2013, accounts opened prior to 2013, those accounts are more likely to max out their contributions. To me, that implies that over time people understand the benefits of the account, the benefits of the tax treatment, not necessarily the benefits of the investments as much, since the percentage of people investing isn't as high as the percentage of people maxing out. But we're not finding what we might have expected to find with respect to differences in generational cohorts, with the millennials that have opened their account many years ago looking more like baby boomers and Generation X from back then as well. So just some key takeaways. Millennials outnumber baby boomers. They're more likely to question the expertise of their primary care physicians. They're more likely to rely on themselves for medical decisions. They have less attachment to the traditional healthcare system, more attachment to alternative options such as walk-in clinics and telemedicine. They're more likely to make cost-conscious decisions and to participate in wellness programs, with the exception of biometrics and HRAs. More satisfied with out-of-pocket costs in various aspects of picking a health plan. And while they're more interested in HSA investments, they do contribute less, and they're no more likely to invest than other generational cohorts. And as you can see from those last slides, that it doesn't matter when they open the account. We don't see any differences there. So we're going to open it up to Q&A. If anybody has any questions, please type them in, and we'll do our best to address them all. And I'll just quickly turn it over to Lori to moderate this section.
Okay, thank you, Paul, and thank you, Victoria. Please ask your questions, and I have a couple of questions to start off with. Paul, with respect to the distributions, millennials have lower distributions than other generations, which is good. Did you look at this with and without investments? Because I recall in other analysis you've done that people with investments actually have higher distributions in general. Is that something we saw with millennials?
Yeah, I have not looked at it for millennials. What Lori's referring to is a slide that I like to present because one of the things that is interesting about HSAs is you could use it as a long-term savings vehicle. And what we've done is looked at whether or not people take distributions by whether or not they invest. And what we have found is investors are not necessarily in it for the long run. We found that investors are more likely to take a distribution, and when they take a distribution, they're taking a larger distribution than non-investors. I think one of the reasons why we're seeing that is because investors have built up large account balances and have the money to take a distribution. So that may be at some point, and you got the 80-20 rule, 20% of the population uses 80% of the spending. At some point, you may be in that 20%, and you want to take a distribution as a result. So the risk of needing healthcare services finally catches up to you, but this is not something we looked at by generational cohort.
So one of your last takeaways is that millennials are more likely to make cost-conscious decisions and to participate in wellness programs, and yet your slide shows that they are less likely to say, only 10% said that they wanted a health plan with a higher upfront out-of-pocket cost, which has lower premiums that incentivize you to shop around for most efficient services. But it seems like they'd be in the best position for that, right? Because they're actually doing the homework, and yet they don't prefer those types of plans. And I wonder, I'm curious to hear what your thoughts are on what takeaways are there for plan sponsors. One that occurred to me was that when you get your electric bill, sometimes it's accompanied or it comes separately, a kind of a peer-to-peer analysis and saying, here's what your neighbors are doing in terms of electricity consumption versus you. And they found that this kind of peer-to-peer analysis can motivate changes in behavior. So maybe if they showed millennials how much more they are shopping around, that they might see that there's a value that they can get out of that behavior in terms of choosing the plan. But any other thoughts on what takeaways there are for plan sponsors?
Yeah, I think the takeaway, clearly there's a disconnect in some of these answers, and I think the thing to look out for, and I kind of mentioned this before, is what happens as the millennial generation ages and starts to develop health conditions like diabetes and high blood pressure and high cholesterol. Do they start to behave more like baby boomers and Generation X. While it's interesting to see that they have attitudinal differences and some behavioral differences, they don't need to be as engaged in their health at this point because they don't use as much healthcare services. So I think that partly explains why you see some of these inconsistencies, because they have less experience than older people. There are some questions coming in that I can see that aren't up there.
Okay.
So let me just address some of the questions that we're getting via chat. First question, any info and stats on take rates once young professionals turn 26 and can no longer be covered under their parents' plan? We don't have that kind of information or haven't surveyed on that in these surveys. So I just wanted to let you know that. And is there any correlation between millennials' use of HSAs compared to, oh, that slide just disappeared for me. That question just disappeared for me. Okay, we'll have to get back to that one. So here's another question. If HSA balances are still just 1 or 2 times a person's deductible, why would you expect to see balances treated as investments? Well, the reason why is once someone gets to the point, and I think it's an interesting question, once somebody gets to the point where they have enough money in their account to cover their deductible, they may be more willing to take the amount of money in their account above the deductible and tie that up in an investment. So for example, if you've got a $1,000, well, $1,000 is probably not right for HSAs. If you've got a $2,000 deductible and $3,000 in your HSA, you may be more willing to take $1,000 and invest that. Keep the $2,000 liquid in the cash account and invest $1,000, because if something happens where you need to tap your account for a healthcare expense, you know that it'd be relatively easy to tap your deductible and still, while you could always sell the investments, I think it's not that the investments are tapped up, but there's always a concern about selling investments at a loss.
One other question, Paul, I had was, you had that slide where it showed that the millennials were far more interested than average in type of automatic investment feature for their unused HSA funds at the end of each year. And maybe that's interesting because maybe it's because they're used to being automatically enrolled in a 401k plan, so they're kind of used to that. But what are the plan sponsors' options for something along those lines?
Yeah, so the plan sponsors can make that available, but it's really up to the individual, the HSA participant, to take advantage of that, because when it comes to HSAs, they're different than 401ks. They're technically not, the account, not the health insurance, the account is technically not an ERISA plan. Individuals are more on their own when it comes to what they do with the money in the account, and it's, the HSA provider that they're using that would make those tools available to them, and then it's up to the participant to, take advantage of that. But those tools are out there in terms of automatic investing. You could set that up. You just have to be more proactive, a more proactive participant.
It looks like we have one more.
Yeah. So related to the question on investing above, a portion of the account, there's a question related to whether or not the money may be necessary in the short run, and maybe there's some relationship between, some health incident crossing plan years. There's no question about that it's not as simple as saying that people with large account balances are more likely to invest, maybe because they have enough money to meet their deductible. I think we have to do a lot more research on why people invest and what may be holding them back. We could speculate, which is basically what we've done, but there are so few people investing that I think one of the things we need to do is start asking people who aren't investing why they're not investing, start better understanding why people do invest when they do, what takes the, why do they wait so long to invest. So I think there's a lot of work we could do there to better understand some attitudes. Another question, do you think employees working for an employer with full replacement HSA plans are likely to behave differently than employees offered both an HSA and other plans? That's a really interesting question because there is evidence of adverse selection or positive selection, choose your term, but the evidence is that when an HSA plan is offered alongside another plan, a non-HSA plan, the HSA plan is more likely to attract healthier people, whereas less healthy people are certainly more likely to stay with the other plan, and therefore you should expect to have different behaviors when it comes to healthcare, use of healthcare services, as well as behavior with the account. We don't have, in our HSA database, while we've got amazingly rich data on the account, we don't know what health plan choices that people have. So of those 5.5 million accounts, or 5.5 million people, we don't know if they're offered a non-HSA plan or if they're in a full replacement HSA. And last question, Generation X, which is still 15 years from retirement, seems pretty unhappy with healthcare. Any thoughts on what's going on with that group? Well, I'll just throw out one reason. As a member of that cohort, maybe it's simply that we're, dealing with issues we never had to deal with before, and it's, no reason to be happy about some of those things. And I'll just leave it at that.
Thanks, Paul. And thank you, Victoria, as well. Appreciate all of your comments. And so just as a reminder, we do have our next upcoming consumer engagement and healthcare survey currently underway. So as Paul mentioned, if you want to become a funder of that, you would have access to the full survey results. You've only seen part of them today. The funders get access to the full survey results. They have input into survey questions, and of course they get the marquee value of being a funder and having their name associated with this very well-respected survey. Other reminders, please sign up for our EBRIs by going to www.ebri.org so you can have the notifications about upcoming webinars. And if you do want to become a member, which I highly encourage you to do, contact me at lucas@ebri.org. Thank you very much for attending our webinar, and we will see you next time.